We all know that vitamins are essential for our overall health. But do you know that certain vitamins can even increase your risk of heart disease if you are diabetic? That's right. But what are those vitamins, and how dangerous they can be for you if you already have diabetes? In today's episode, let's learn about which of these vitamins you should avoid if you have diabetes. Without any further delay, let's begin. Number 1. Vitamin C. We all know that vitamin C is known for its immune-boosting properties. Vitamin C is an antioxidant that helps protect your cells from damage, supports the immune system, aids in wound healing, and promotes the absorption of iron from plant-based foods. However, taking too much vitamin C can be bad if you have diabetes. Actually, vitamin C doesn't cause your blood sugar levels to rise. However, vitamin C supplements often come in the form of sweet gummies or chewable tablets that may contain added sugar. Also, taking high doses of vitamin C can cause gastrointestinal issues, like diarrhea, nausea, and stomach cramps, especially if taken in supplement form. This can happen if you are taking vitamin C supplements along with many vitamin C-rich foods, like citrus fruits and juices. Moreover, high doses of vitamin C can also interact with certain medications you might be taking. For example, vitamin C supplements can interfere with the effectiveness of certain blood-thinning medications or certain medications related to kidney function. To avoid these issues, try to take vitamin C from whole fruits and vegetables, such as oranges, lemons, strawberries, bell peppers, and broccoli. They are less likely to cause vitamin C toxicity. Also, take vitamin C supplements only with the advice of your health expert, as they can better tell you about the suitable dose of vitamin C according to your diet and your body's needs. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Niacin. Niacin, also known as vitamin B3, is an essential water-soluble vitamin that plays a key role in many physiological processes in our body. It is involved in energy production, metabolism, and the maintenance of healthy skin, nervous system, and digestive system. Niacin is also often used as a treatment to help manage cholesterol levels. Sufficient amounts of niacin offer heart protective effects, but if you have diabetes, taking too much niacin can worsen insulin resistance, leading to imbalanced blood sugar levels. High doses of niacin can also affect your liver function and cause your liver's enzymes to increase in your body. But avoiding niacin altogether is also not a good idea. Niacin deficiency can lead to a condition called pellagra, which is characterized by symptoms such as skin rashes, digestive issues, and neurological problems. If you have diabetes, try to avoid niacin supplements unless advised by your doctor. You can take moderate amounts of meat, fish, chicken, whole grains, potatoes, avocados, nuts, and seeds in your balanced diet to get a healthy dose of niacin for your body. Number 3. Biotin. Biotin, commonly known as vitamin H or vitamin B7, is a water-soluble B vitamin that plays a major role in many biochemical processes in our body. It is essential for maintaining healthy skin, hair, and nails, and it's involved in the metabolism of carbohydrates, fats, and proteins. Biotin is important for cell growth and repair. It is involved in DNA replication and plays a role in maintaining healthy skin tissues. However, experts say that biotin supplements can interfere with certain lab tests, including the ones used to monitor blood glucose levels. High-dose biotin supplementation can show inaccurately high or low levels of blood sugar in these tests. This could be because biotin is a cofactor for certain enzymes involved in the metabolism of glucose or sugar in our body. It's best to take biotin from natural, whole foods, such as nuts, seeds, eggs, whole grains, lentils, soybeans, black beans, broccoli, avocados, and bananas. They are less likely to cause biotin toxicity if taken as a part of a balanced diet. Number 4. Vitamin E. Vitamin E is basically a fat-soluble vitamin and a powerful antioxidant that's really important for our overall health. It helps protect our cells from oxidative stress by neutralizing harmful free radicals. However, taking high doses of vitamin E via diet or supplements can affect glucose metabolism, which can imbalance your blood sugar levels, particularly if you are already diabetic. Vitamin E naturally has mild blood-thinning properties, and taking too much vitamin E via supplements can increase your risk of bleeding. In fact, some studies show that overdosage of vitamin E can potentially increase the risk of heart failure in people with diabetes. But that doesn't mean you can't take vitamin E at all. You can take enough vitamin E from many healthy foods like nuts, especially almonds, in addition to sunflower seeds, extra virgin olive oil, fatty fish, spinach, and broccoli. Number 5. Vitamin B6. Vitamin B6 or pyridoxine is generally required by our bodies to break down proteins, maintain healthy nerve function, make hemoglobin for our red blood cells, and even for the formation of antibodies by our white blood cells. It is also essential for maintaining a healthy skin, but if you have diabetes, there's something you should know. Too much vitamin B6 can cause nerve damage, leading to symptoms of neuropathic pains and other issues. Diabetic people usually have a higher risk of developing neuropathy. In fact, studies show that there is a close relation between excessive vitamin B6 intake and neuropathic symptoms. Not just that, taking excessively high doses of vitamin B6 can interact with certain medications that you might be taking for diabetes management. So instead of supplements, you must prefer taking vitamin B6 from healthy foods like poultry, fish, organ meats, whole grains, nuts, seeds, beans, bananas, and avocados. Number 6. Iron. Although not a vitamin, iron is crucially important for our body, particularly in the formation of hemoglobin and our red blood cells. It is also involved in metabolism, brain function, and the production of neurotransmitters that transmit signals between our nerve cells. However, if you have diabetes, you should avoid taking too much iron. And there are many reasons for that. When there's too much iron in the body, it can cause a condition called hemochromatosis, which can cause organ and tissue damage. In fact, hemochromatosis can also lead to type 2 diabetes if it damages the pancreas, your insulin-producing organs. Too much iron also promotes the formation of free radicals in your body and can increase your risk of getting heart disease and strokes. Too much iron can also worsen insulin resistance, making it more difficult for your body to control blood sugar levels. So you should avoid taking iron supplements without a doctor's advice, especially if you have diabetes. One way to get your required dose of iron is via healthy foods, like lean beef, lamb, fish, nuts, pumpkin seeds, sunflower seeds, spinach, and collard greens. Number 7. Calcium. Okay, everybody knows how important calcium is for our bones and muscle function. And many women take calcium supplements for strong bones. To be honest, it's not a bad thing. But if you are taking too much calcium from foods or supplements, or if your body is not absorbing calcium properly, it can cause hypocalcemia, a condition in which there is too much calcium in blood vessels. Hypocalcemia is a serious risk factor for heart patients and kidney patients, and it can also lead to the formation of kidney stones. Plus, too much calcium can also worsen insulin resistance, making it difficult for your body to control blood sugar levels. One thing you can do to minimize this risk is take enough vitamin D and vitamin K2. Vitamin D helps your body absorb calcium from foods you eat, while vitamin K2 helps deposit calcium in your bones and teeth. Thank you for watching and subscribing to the channel. See you in the next video.